Well, hello. Thanks for tuning in to another alumni chat. If you're wondering why I've got this tie on, because I don't normally, it's because we're talking to somebody pretty special today, at least pretty special to me, and you'll find out in a minute why. I'm with Dr. Kendall Cortelyou, who is a director of the School of Global Health Management and Informatics here at UCF. If all that sounds familiar, you must have heard me go through one of these spiels because that's where I work. And Dr. Cortelyou is my boss. Uh, we uh, we appreciate your time today, Dr. Cortelyou, because I know from experience how busy you are. We'll try to make sure this is meaningful but relatively painless.
Absolutely, Shannon. I'm really happy to be here. I love your alumni chats, and I'm definitely honored to be a part. So thanks for having me.
Well, the main thing is you got to be an alum, for to make the chat, right? So you must have gotten one or more degrees from UCF somewhere along the way, or we wouldn't be talking, right?
That's right. That's right. Yeah. Yeah. I've gotten two degrees from the University of Central Florida, happily, both my master's in health administration and my PhD in public affairs. So, two degrees. I'm a proud double knight.
And how long have you been with the university?
So it's hard to believe, but I have been at the university for now 24 years. I was 5 years old when I started. I was on the fast paths, kindergarten straight into the university. But I am proud to say that I've been here for 24 years. It's been a wild ride for 24 years.
Yeah, and as you know, we're doing these to expose our students to all the various career types that are available out there. Yours is a unique one, and we
It
want to
is.
explore that a little bit. But first, why UCF? Why'd you choose
So,
UCF in the first place?
So it's an interesting question. I did my undergraduate work at the University of Florida in Gainesville. I and lived there, lived in Gainesville for 4.5 years. I did manage to extend my undergraduate degree to include one more football season because I'm a very big college football fan. That was well worth it. But while I was work in Gainesville, I worked at a hospital up there. I worked in the human resources department and got exposed to healthcare and really loved it. Loved the fast pace, loved the excitement, loved working with such a variety of people. And so I decided to get my master's in health administration. And nothing negative to say about my colleagues in Gainesville, but the opportunities that present themselves in Orlando are just significantly greater than those in Gainesville. I enjoyed my time in Gainesville, but when it came time for graduate school, I really looked around and thought, where can I have a bountiful life? Where can I create a career? Where can I build relationships? And Orlando had all of those to offer. So I came down and met with the advisors in the Masters of Health Administration program, who are still here, by the way, my initial mentors, and met with Dr. Ochen and really fell in love with the opportunities that are presented as being a part of such a large university, a large program that has connections and relationships with the community and with the hospital system, the healthcare system right here in Orlando. Just it gave me so much opportunity. So UCF won by a long side.
That's great. So if you're out there watching this and you're trying to decide where you want to go to school to get a great education in health management and informatics, I think Dr. Cortelyou just gave you the speech for
Yeah,
that.
yeah, that is true. That is true. This is not a sales pitch, but those were really my own motivations to come back to Orlando and to really live in such a thriving healthcare environment.
Well, I have family in Gainesville and a daughter-in-law at Shands, so I know a little bit about that market area, but this market is very different.
Very.
How many hospitals in this market as
Oh my God.
opposed to how many hospitals in the Gainesville market? So
Yeah.
I think that is one of our attractions and one of our draws when students are trying to decide where to come. Briefly, tell me about that whole career path. You you got your degree. Did you go straight into your PhD work?
I did. I did. I worked for about a year in healthcare while finishing up my bachelor's degree, and then came directly into the master's. And so I came into the master's program here, was a graduate assistant for Dr. Ochen, who is also still on the faculty, And she and I worked together for several years. And during that time, I got to work with another faculty mentor, Dr. Myron Fotler, has since passed, but he was an amazing mentor to so many individuals in this field. And he's the one that was really like, I think you should think about getting your PhD. And I thought about it. Not something that was really occurred to me. This was not my lifelong dream growing up, but I'm certainly glad that I listened. And I started pursuing PhD. What is really kind of unique about my background is that then I took kind of the long and winding through administration and faculty at the university. I like to say I have been in everyone's shoes in this unit. I have been a student. I have been a graduate assistant. I have been a receptionist. I sat at the front desk. I have been the budget person. I've been an advisor. I've been a non-tenure track faculty, a tenure track faculty, you name it. I was even the assistant director of our college for about 4 years while I was getting my PhD as well. So I have taken a very interesting road in that I literally have sat in every seat, and it gives me such an interesting perspective. I love that I took that road. It was long, but really gives me insight into what the journey is for every single person that I come in contact with.
So I want to make an observation
Yeah,
quickly, and then I want to throw something at you that we haven't talked about, just
sure.
to see how quick you are on your feet. But
Okay, great.
my observation is from working, 25 years as a senior executive, 40 years in the industry, when I look at you and what you do, it is very similar to managing a very busy medical practice. You're dealing with high-end terminal degree people who are very opinionated. You can't just tell them what to do. You have to influence them. And so I think that your skill set could be easily transferred pretty much to any other segment of the industry, and you could be successful.
Oh, I definitely agree. The leading in higher education is very similar to leading in healthcare. For one, I mean, everybody that works here is can go anywhere they want at any time. I mean, we're really talking about people who are very portable. They have a certain skill set. They've got high degree of education, an incredible skill set, and they could go anywhere they want, anytime they want. So it's important for the leaders to understand that, appreciate that, but not get tied down in that. You still have a job to do. You still have to move the organization forward. You still have to make things happen. But the certain soft skills, the essential skills that we talk about really come into play. That emotional IQ, really being able to motivate people for other reasons than money, because I don't have access to, I can't just give people raises. I have to find intrinsically how to motivate people to do what's best for the organization. And it's a challenge, and it's very similar to healthcare.
But it is an art.
Oh, for
It's not,
sure.
not
Yeah.
something that we can just teach. We can teach you the knowledge, but we can't teach you the skill. Uh, so this is the one I just want to throw it out quickly
Sure.
because many of our students are, uh, parents. They're
Yeah.
going to
Yeah.
school. They're trying to figure out, what to do. You're a mom,
I am.
and I know
I
how demanding your job is. How do
Yeah.
you balance all that?
Yeah, sometime in that long and winding career path I gave you, I had two children, and it definitely made for an interesting time. And I also think, again, like that experience makes me a better leader now, helping people juggle that balance because there is no work-life balance. There's sometimes your work takes up more room and sometimes your life takes up more room, but the two are never gonna equal each other out. And I understand that. And I think that's something that everybody can bring, even if you haven't had the experience, the knowledge that you can't expect your employees to always be 100% work. You people have lives and they have what they need to do. I was fortunate. I had wonderful mentors who helped me navigate that challenge. But I also stepped up when I had to, and I did prioritize work sometimes. I mean, I told a story recently at an ACHE event. I had my daughter. She was what, a month old probably, and Dr. Ochin came to my house, and I have a picture of her sitting there holding my tiny baby. And she said to me, "Hey, there's a job and you really need to apply for it. I know this is bad timing, but you got to do it." And I was thought, oh my gosh, I literally just had a baby. I have to do it. And sometimes, you have to ask for help from your family, from your spouse, from your village. And sometimes you do have to consider what has to come first in work. Not to the detriment of your family, certainly not to missing things, but sometimes you do have to pick one over the other. I mean, I've asked you to step in for me when I've had events that coincide with my daughter's homecoming dance, or a school play, or whatever. You can always lean on people. It's not a weakness to lean on people. And I think sometimes, especially, I won't speak for my whole gender, but sometimes women have a hard time with that. Think they have to do all things to all people, but you don't. You just have to prioritize what's really important and ask for help on both sides. I am very fortunate. I will shout out to my parents who helped take care of my kids when I was in those early years in the thick of it. But it's also, having a wonderful relationship-based faculty and group of working colleagues.
So my boss hates it when I let these run over,
Uh,
but I bet you'll let me get one more
sure,
in.
sure, sure.
Real quickly, students walking through the office, they see your door open, they stick their head in the door and they say, "Dr. Corley, what advice do you have for me? What's the one thing that you would think top of mind?"
If I can give every student and every person out there listening, my one piece of advice is that relationships are everything. Everything. If you have good relationships in your organization, you're not afraid to go and say, "Hey, Shannon, can you cover for me? I have this thing with my children." Or to say to anybody, can you cover for me? Can you help me out with this? Hey, I had to bring my child here. Can they sit in your office while I have a meeting? I mean, there's all kinds of things, but relationships are everything. They help you get your job, they help you keep your job, they help you flourish in your job. And if there's one thing in my life, in both personally and professionally, that I take most seriously and are most important, are my relationships. And if you can generate those, and they have to be authentic, those authentic relationships, those connections you make with people will get you far, and will really make your life worth living at the same time.
You know me so well that I actually preach that
I
to
know.
my students as well. So
Yeah.
I want to thank you so much for your time today. I know how busy you are, but we appreciate you. We appreciate your leadership. And I guess I should sign off by saying, hey, go Knights.
Yeah, charge on.
Thank you.
Absolutely. Thanks, Shannon.